So how are we different? I have just described every single problem and layers of testing that I will do for patient. That is how different. Because other medical doctors, they will not do these kind of tests. Either they don't know, or they just don't want you to do. They just don't want you to do it. All they want to do is stuff medication into your body. Just keep on stuffing medication, and they say you're crazy, and they say you're out of your mind, and they say you're all normal. There's nothing wrong with you. But matter of fact, because they do not care enough to find out the right test to test for you. So that's why we are different. We leave no stone unturned. We find out exactly what's causing problem. Everything you have, we'll find out for you. With blood tests, with other testing. With brain tests, nerve tests, neurological tests. Okay, now we're going to talk about therapies. What therapy are we going to use to help you recover? To improve your thyroid, to help you remove the layers that we talked about that affects the thyroid. Again, if once we do the therapy, the layers are gone, the body is going to start healing the thyroid in itself. The body will heal itself. The body will heal. Okay? So again, supplementation, herbs, homeopathic, in itself is treatments. Okay? Having the right whole food supplement, having the right food, eating the right herbs, eating the right homeopathic, your body is going to get better. Your body is going to heal. Having the right supplement will what? Will support your gland, your organs. The right supplement will stabilize your sugar, will clear the inflammation. The supplement will help you take away all the pathogen, all the infections. It will repair your guts, it will detox the body of your liver and gallbladder and kidney. Will address the anemia, your blood problem. You will balance the hormone. You will address the autoimmune issue. That's what the supplement will do if taken the right kind of supplements. Okay, and every person come to me. I do not give the same supplement to everybody. First of all, I do pause on every single patient. And we do blood tests, and whatever the result of the blood test, whether the result of the brain test, result of the neurological testing, okay, result of my pulse test, and then I put it together, and I design a plan. I give you a program, supplementation, the right supplement, the right herbs, the right homeopathic. Give it to you. You go home and eat them. And that's how you recover. Okay? The right diet control. Not only are you going to be taking supplements, herbs, homeopathic, you are going to control your diet. They are good food, they're bad food. Okay? And according to your blood test, I will determine what foods are good, what foods are bad. Even though fruits and vegetables, even though fruits are great, but there are some fruits that you just cannot eat because it's going to cause increase in inflammation. It's going to cause increase of sugar level in the body. Okay. There's another therapy called Rife therapy. Rife therapy will help you in regards to the bacteria, viruses, fungus, and parasite. Okay, really, really great therapy. Okay, and it will help you release inflammation, release sugar, and all that. Okay, nerve therapy. Like we said, if we found out that your thyroid is affected by the brain, and we found out through the brain test that there is certain brain pattern it's off, then we use a nerve therapy to correct that brain path. So the connection of the brain and the thyroid are made. Laser. Every patient that has thyroid issue always accompanies some kind of pain. Arm pain, joint pain, neck pain, lower back pain, and we use laser to take away the pain. We use laser to take away inflammation. We use laser to heal the tear, damaged tissues. We use laser to increase circulation. So laser has tons of great functions. Okay, we have detox therapy, HIFAMAD. All right, so not only do we use supplement to detox, there's a machine, HIFAMAD, that can help you drain off all the toxicity in the body so that it will get to the lymphatic system. It will help your lymphatic system to drain off all the toxin to the poops and to the urines. Great, great machine. Okay, PEMF, electromagnetic pulse. We also do that to increase your overall energy system. So the body has a function, has the ability to increase the drainages, to increase healing with the thyroid. chiropractic adjustment. Why? Because when we adjust the spine, the nerve impulses on the spine is going to produce more flow to the organs. Okay, thyroid, the nerve supply of thyroid comes from the neck. The nerve supply of your heart comes from the mid-back. The nerve supply of the liver and kidney comes from the lower back. So once your spine is doing really well, once your spine is great, the nerve flow in the body is going to flow. Well, once nerve flow is good, your organ is going to be healthier. Your thyroid is going to be healthier. Your muscle, your tendon, your ligament, all is going to be healthier. Just all by aligning the spine. Extremely important. Very, very few people know about this one. Okay, and decompression. Why? Because a lot of patients, when they come to me, thyroid patient, they have a lot of back pain and neck pain, and a lot of them have tingling sensation from the arm to the hands, or tingling sensation from the lower back to the toe, and that's a classic symptom of disc herniation, accompanied with thyroid, accompanied with autoimmune, accompanied with inflammation, accompanied with tons of other problems, just all come together, causing the body to go crazy, just to be totally malfunction. Okay, and if you have an issue with herniation causing the nerve compression that shoots down your arms and legs, then this machine will help big time in relieving the disc herniation without the use of surgery. Without the surgery, you can be helped and healed of all the tingling sensation, numb sensation in the arms and legs. Okay. Another therapy that we use, we call it combo ultrasound stimulation. And there's different type of stimulation that we use. It depends on the body's need or conditions. Okay. It just overall kind of strengthens the muscle, relaxes the muscle. Basically, that's what it does. Okay. And we also use energy treatment. Energy treatment such as NAT, okay, now nutritional response technique, NAT treatment, allergy clearance technique, field control technique, Reiki, Qi energy. We do Qigong here as well too. We use the Qi energy to regulate a patient's body as well too. We use an emotional technique to help us release the emotions, which also accompanies the thyroid condition as well too. The thyroid patient, everyone comes with baggages of family problems, personal problems, stress issues. Okay, all the stress issue could cause tons and tons of harm to the body. Okay, that's why I have to learn all these techniques to help with the thyroid, just a thyroid condition. Okay, acupuncture, point therapy, with laser to do that. Movement therapy will help you to design the right exercise for you to go home in order to help you with your thyroid, with your pain, with your fatigue, okay, with all the other symptoms that you have. Okay, these are the energy therapies that we do. Okay. Now I want you to imagine being on a cruise. Imagine yourself standing on the deck of the cruise, pain-free. Imagine yourself having the wind blow in your face, having to enjoy the travels, the recreation, having to totally enjoy the food, enjoy the people, enjoy your family, without pains, without fatigue, without all the stresses in the body, without all the discomfort in the stomach and the constipation, without having to worry about, you can't sleep tonight again. Imagine all that. You're free of pain. Imagine that. Imagine you can eat all kind of food you want and without having to worry about your health. Imagine all the food that you ever enjoyed. Imagine when you were small, when you were in the 10s, 15s, and 20s. Imagine how wonderful the life was at that time. You're totally pain-free. You have no problems. Imagine that. Once you finish imagine, do you want to go back to that? Do you want to be pain-free? Do you want to go back to your 10s and 20s when you're full of energy, full of worries, worry-free? Okay, if you do, let me know. Come to me. Give me a call. We offer 2 free consultation. 2 free consultation. Why? because I want to give you a chance to understand your condition, to know your condition. There's no obligation. You will not have to pay a single dime. You come to me, let me explain. Let me help you find out what your problem is. Okay, I will not charge you. Okay, so what this consultation consists of? So you come to my clinic, give me a call, you fill up the forms, and you come in, I do a full history. I do it, whatever you have, whatever exam you ever did, okay? You come here, tell me about your conditions, and if I find out that you need certain testing, if your blood test is not enough, if all your blood test shows normal, and yet you're messed up, you're a mess, so I will give you a written prescription for blood tests. I'll give you a written prescription for brain tests, for nerve tests, okay, for acid tests, for stool tests, for blood, whatever test it is you need, I'm going to write that for you. Okay, you go take the test. Okay, and you go home, and the next visit when you come, we have all the reports. We have all the result of the blood tests, of the nerve tests, of the MRI, of the X-ray, other tests. And then I'll give you a report of finding. I'll let you know what's going on with your body. I'm going to tell you what's missing in your life, what nutrient you're missing, what's going on with the blood test. I'm going to tell you what kind of care you need, how long is the care that you need, how much is the cost going to be. I'm going to tell you all that, okay, with a 2 free consultation. Okay, so during the consultation, I would highly recommend that you bring your spouse with you, that you bring the significant other with you. Why? Because if your significant other come, they will fully understand your problem. Once they fully understand, they will support you financially. They will support you in your time. They will support you in your family time, and they will understand why you're so tired, why you can't do certain house chores. They will understand why you go to work, you come home tired. They will understand the whole thing. They'll give you all their support. If your spouse do not come, you have no support whatsoever. You're going to be very difficult by yourself. Okay, so please bring your spouse with you during these 2 consultations. Okay? So if you're ready to come, if you're ready to give us a call, if you're ready to come for the consultation, there are rules that I must tell you before you come. These rules are, you have to be committed. You have to be committed to getting well from 1 to 10. You have to be on a scale of 10. If you are on a scale of 3 or 4, thinking that you are okay, that you could actually live okay without having any kind of treatment and testing, then don't come. Then wait until you are in a severe case. Then I will help you. Okay? So you mentally have to be committed, have to be 100% committed to improve your health. Then I will help you. You have to prepare to have your lifestyle change. You have to prepare to change your diet, to change your habit, because there will be food that you cannot eat. There will be supplement that you have to eat. Okay? So certain food that you cannot eat, you have to understand that because these food will cause more problems to your thyroid. So I will control your diet. You gotta mentally and physically prepare for that. You have to be responsibility. You have to take the responsibility of your own health. I am not responsible. I'm here to guide you. I'm here to tell you what to do. But to get better or not depends on you. It's your body. You have to do what's right. You have to work at it. Just like preparing for a test, just like going through college. It's not the teacher's responsibility. It's your responsibility to get an A. It's your responsibility to pass the course. Just like the body is yours. Okay, you have to work with me to get the best result. Okay, now you have to understand that the entire treatment packages, it's not covered by the insurance. Insurance will not cover these. Okay, these are alternative. These therapy and these treatments are really, really effective. And the insurance company, they only pay for acute cares. Let's say, for example, if you fall, if you're hit by a car, if you injure at work, yes, acute care, they'll care for you. Okay? If you got a cut, if you have a lot of bleed, if you bleed a lot, they will take care of you. But for chronic condition, thyroid is categorized as chronic condition. Chronic condition insurance do not cover. You may have to, you may ask me, well, will my insurance cover? Yes, insurance will always cover a small percentage. It will cover the chiropractic adjustment, it will cover some of the therapies that we do for you, but it will not cover the majority of the cost of the program. Okay, so be prepared when you come. If you are committed, if you are prepared for the responsibility to get better, you also should prepare that you are going to be spending a fair amount of money. I do not know how much until you come, until you bring over all the tests. Then I can determine how to treat you and how much it's going to be. Okay. So what is it worth to you if we could improve your health? What is it worth to you? Is your health worth more than a car? Is your health worth more than a house? Is your health worth more than a vacation? What is that worth for you? If you think your worth is number one, is priority, and you are going to do anything you can to get better, give us a call. Okay? And our phone number is 626-281-0510. Again, my name is Dr. Lin, 626-281-0510. You can also email us to schedule your consultation. Okay? And this is Dr. Lin. Thank you for watching.